Hello, I'm Tanya Edwards, Executive Vice President of the Southwest Region for the American Heart Association. It is my privilege and honor to celebrate you today, to celebrate you and all of your accomplishments. You are our most accomplished health professionals. Every single day you work in our communities, and we so appreciate each and every one of you and everything that you do. Your participation in the American Heart Association and American Stroke Association quality programs and commitment to quality stroke care for our patients is improving outcomes and saving lives every single day. As Nancy mentioned, stroke remains the largest of our Get With the Guidelines programs. Through your efforts, 90% of stroke discharges in the Southwest region have come from participating hospitals like yours. And that's with only 40% of hospitals across our region participating in programs. I thank you for your relentless commitment to providing clinical excellence to patients across our region. Our collaborative efforts over the last 2 decades have made significant progress towards improving lives of our residents. But as you know, over the last 2 years, we've all witnessed how the pandemic has intensified health disparities across our communities. As champions of health equity, the American Heart Association remains committed to minimizing barriers of quality care. One special focus will be on rural health. We know that there are many barriers, including shortage of healthcare professionals, also challenges with sustainable funding models for hospitals and healthcare facilities in our rural communities. And all of these things negatively impact the access to quality care for residents in these rural areas. In the Southwest region, over 6.5 million people live in rural communities. And so we are creating high impact, transformative solutions that will better serve these communities. We are committed to eliminating health disparities in all of our communities, improving quality of care, increasing our partnerships with our healthcare professionals. And so in the Southwest region, we will be pulling together a healthcare council with our healthcare systems across our 6 states so that we can continue to improve our partnerships and improve quality of care that is provided to all of our residents and all of the patients in the Southwest region. I'm encouraged by the collective impact that we've made over the years, and I'm confident that through our continued partnerships, we can continue to drive significant health impact, improving lives, saving lives, and helping people to live longer, healthier lives throughout the Southwest region. So on behalf of the staff, the volunteers, and myself, I would like to say thank you for your resounding commitment to our communities and the patients that you serve every single day. I look forward to the accomplishments we'll celebrate when we're together in person again next year. And until then, thank you so much for everything that you do. Please join me in welcoming Dr. David Wheeler, President of the Southwest Region Board of Directors.
Greetings from Casper, Wyoming. It really is an honor to recognize the life-saving work done by the many health professionals on this call today. Your commitment to quality stroke care and your participation in Get With the Guidelines Stroke is improving outcomes and saving lives every day. As Tanya mentioned, 90% of stroke patients discharged from hospitals in our region are captured in Get With the Guidelines. That means that more than 73,000 patient records are entered and evaluated by you every year. And we know that these patients are seen according to the latest evidence-based guidelines. Congratulations to the more than 250 Southwest Get With the Guidelines stroke hospitals who achieved Gold Plus for consistently applying evidence-based care for over 2 years. Your consistent commitment makes all the difference. These awards represent your commitment to guideline-directed care for every eligible stroke patient, ultimately saving lives and improving patient outcomes. The continuation of your commitment to quality will be vital to our ability to improve health in both urban and rural communities across the Southwest region. Over the next 2 years, the Southwest region has set a bold goal to reach all 45 million people living in our 6-state region. Over 8 million people live and work outside of our major markets, and over 400 counties in the region have fewer than 50,000 residents. The hospitals in these smaller communities were hit particularly hard by the COVID-19 pandemic. With your help, we can work to develop solutions across the region to support and empower them as they continue to bounce back. Additionally, we know that by driving statewide policy change, we can create impact in these communities. We will continue to collaborate with other organizations and individuals to drive policy change to improve health equity and healthcare access, increase CPR education, drive healthy lifestyle changes, reduce tobacco usage, and increase water access, and much more. Our outpatient work, focused on hypertension control and lifestyle modifications, helps ensure that we're providing training, resources, and education to communities both large and small. It also helps drive the individual change side of the health solution, creating a holistic approach to chronic disease management. This year, we're thrilled to be able to gather together with some of you in person for the AHA's International Stroke Conference in New Orleans in February. Hundreds of attendees from around the world gathered to hear the progress and the impact that we're making on stroke care, including advancements in endovascular intervention and early research on the impacts of COVID-19 on stroke risk. We also honored 12 leading stroke scientists for their exceptional achievements in stroke research. Still, we learned about the work yet to be done. Social determinants of health impact risk factors and outcomes for patients, and health inequities must be addressed to impact the quality of life for survivors and caregivers. Through your connection to AHA and Get With The Guidelines, your stroke teams are contributing to the worldwide knowledge base and future opportunity to improve care. So on behalf of AHA, thank you for your resounding commitment to the communities that you serve and to the patients you treat. Now, please enjoy a message from the American Heart Association Quality Improvement Team.
On behalf of the American Heart Association in the Southwest region, I would like to thank each and every healthcare organization for your commitment on stroke education. Thank you.
On behalf of the American Heart Association, thank you for your hard work over the past year. We know it was difficult, but your energy, support, and resilience are greatly appreciated.
Greetings. I am Dr. Takia Wilson, and I am so excited to congratulate all of our Get With The Guidelines stroke awardees. Thank you so much for your dedication, your willingness, and your commitment to improving patient care. We congratulate you and thank you once again for being a relentless force for a world of longer and healthier lives.
A heartfelt congratulations for all of the wonderful work that you've done over the last couple of years. We know that keeping up with programs like this has not been easy amidst the pandemic. And we just want to reiterate our gratitude and thankfulness for all of the work that you do every single day to maintain such high levels of stroke care across our region.
and congratulations to all the award winners. You did it. You persevered through unbelievable challenges. The commitment and dedication of you and your staff is why you earn these awards.
You all have remained a constant, relentless force for improving stroke care across the country and for this very specific population.
Hello, healthcare partners. I am so grateful to be here to celebrate with you all your achievements. I know that it takes a village to build a stroke program, and you obviously have built that village. Congratulations, and thank you for all your support over the years. It's such a pleasure working with each and every one of you, and congratulations again for all of your achievements.
Your commitment and dedication to providing evidence-based stroke care is still at the forefront of who you are. So again, congratulations and keep up the good work.
On behalf of the American Heart Association and our Quality Outcomes Research and Analytics teams, we would like to extend an immense thank you to all of our nurses, physicians, quality improvement teams, and other healthcare professionals that work together every day to help improve our stroke patients' care, processes, and outcomes. You are making such a difference in our stroke patients' lives and communities here in the Southwest, and we are so incredibly thankful for each and every one of you for all that you do daily. Thank you again, and congratulations to you and your teams.
Once again, and on behalf of the Southwest Region Board of Directors, thank you for your participation in driving quality care and better access to care across the Southwest region. Nothing highlights the impact of this work better than stories. We want to tell the stories of the lives that you are all impacting. You're going to receive a follow-up email detailing how to share stories from your community so that we can continue to elevate the work that you all do across the nation. In May, Stroke and High Blood Pressure Awareness Month, the American Heart Association will be highlighting stories of the healthcare professionals through our social media channels. But we wanted to go ahead and give you all a preview of one of those stories from right here in the Southwest region. Please meet Kate, a featured survivor at our recent Go Red for Women luncheon in Denver.
It's weird being panicked and not being able to tell anyone what you want or need or who to call. The part I try not to think about is that there's no cause, and I don't know why this happened to me. My name is Kate, and I'm an ICU nurse. Couple important things about me. I love to talk, I love to pet dogs, and I love to help people. Greg and I have been dating for just almost 2 years, and we met online, just like everyone else. I grew up in Littleton in Colorado. I graduated with a degree in journalism. Promptly didn't use that. I applied to nursing school, got in. After I passed my boards and graduated, I applied to only one position with an ICU team. January 2020 started off normal, but it took a hard right. I woke up, got out of bed, my right leg went numb, and that panicked me. As a nurse, it almost immediately felt to me to be neurological. And at that point, I decided I needed to go to the hospital. I walked into the emergency room. They did a full stroke workup and everything was negative. They sent me to the floor. I stayed overnight and they discharged me. We were planning to go to a friend's wedding in Mexico. As far as I was concerned, everything was fine. We went home and started repacking and planning for our trip. The next morning, got up, started doing my hair, full face of makeup, and headed off to work. And on the way to work, Greg texted me good morning, and I parked, and I kept trying to text good morning or I love you or something like that, and nothing came out, so I just wrote hi, and that wasn't right. I still didn't think anything was wrong, and as I was clocking into work, I noticed something was wrong, and it wasn't as easy as normal. My coworker was telling me a joke, and I normally love jokes, and I wasn't responding, and she thought that was weird. She said, "Kate, I told you a joke. Normally you laugh." And I turned and I looked at her, and she goes, "Oh my gosh, is that droop normal?" My eyes got wide, and I grabbed my face, and I tried to say something, and nothing came out. And I could think all my words, but my mouth wouldn't do anything. and she called a stroke alert on me, and all the doctors that I work with and coworkers responded to me. And within minutes, they had me down in CT, and pretty quickly, they told me that I'd had a massive stroke. And in my head, I was like, great, we caught it within the first couple minutes. They're going to fix it. This is all going to be just fine. But I couldn't say that. Instead, what they came back and said was that the stroke had happened in the middle of the night, and there was no way to reverse it. And I was crushed. And there's a weird feeling when you've been a straight A student and always shot for the top of everything, and you think you're losing a part of your brain and you're not going to get it back. At that point, they sent me to the ICU, and then all my friends came to visit, and my friends that we were going to go see in Mexico for the wedding showed up, and they brought us sombreros and maracas, and we celebrated in the ICU. After 5 days, I got home and I started speech therapy, and within a month, I was almost back to myself. I remember my mom saying, who we know is still there. You're just struggling to find words. We joke that we both sit at the table and can't find words now. As an ICU nurse, we learn how to treat stroke patients, but I realized I'd never talked about it with my friends or family. And now I think everyone has a magnet about FAST. F is for face. For me, it was the droop. A is for arm. You might have weakness in the arms. And then speech, you could have slurred words, or in my case, no words at all. And then time. The faster you can respond to something, the better off someone will be. From the bottom of my heart, thank you to everyone who gives so generously to the American Heart Association. Together, we can work towards a world free of heart disease and stroke, so no woman has to go through what I did.
You all have to I want to send a thank you to Kate for such an inspiring story and a perfect example of why the work that you do is so important. Thank you, Kate, for sharing with us all. We know that you all have similar patients in your community, and we would love to highlight them. They can share their examples with us throughout Stroke Awareness Month on Twitter and Instagram using the hashtag AHA Stroke Impact. As we close, I want to thank you for attending today's celebration. We look forward to announcing the 2022 awards in early summer and as your 2021 data is finalized. If you qualify for a 2022 award, you've earned it, so go ahead and flaunt it. This year's award toolkits include a few new items that you can use to promote your hospital's award, including examples of all pull-up banners, in-hospital customizable videos, as well as ads and other materials that your hospitals can use to share your accomplishments. Congratulations, and thank you for your hard work. We'll see you all next time.